Okay, in this short video, we are going to look at muscles of the shoulder. So these are going to be muscles that move the arm, primarily the glenohumeral joint. So let's take a look at some of the basic anatomy that we can see at the front. Let's review. Here's the clavicle. Here's the manubrium of the sternum. Here's your sternal angle. Here's the body of the sternum, Deltoid process. Going from the clavicle, the manubrium, and the sternum, going to the bicipital groove is a muscle called Pec Major. And it is an adductor of the shoulder, and it's also an internal rotator of the shoulder. Superficial muscle. Deep Pec Major, we'll see a muscle called Pec Minor, but we just don't see it in this view. Superficial, we have the deltoid. This is the anterior deltoid. On the lateral side would be the middle deltoid. And on the posterior portion, posterior deltoid. The anterior deltoid flexes the shoulder, posterior deltoid extends the shoulder. General rule of thumb, if muscles are on opposite sides, they're going to be antagonistic to one another. The anterior delt will flex the shoulder, whereas posterior delt will extend the shoulder. The middle delts will abduct the shoulder. Okay, then in the front of the arm, of the humerus, we see the biceps brachii. Bicep means two, so there's a short head and a long head. If we dissect away the pecs and the delts, then on this left side, right, the person's left-hand side, we can see that the biceps brachii has two heads. There is a short head, which originates on the coracoid process of the scapula, along with the coracobrachialis that originates there. And then the long head of the biceps originates on that supraglenoid tubercle, which is just above the glenoid cavity of the scapula. The long head travels through the intertubercular groove, known as the bicipital groove, which is between the greater tubercle and the lesser tubercle. So the biceps has a long head and a short head. The short head originates on the coracoid process, along with the coracobrachialis. If you look at the name, coracobrachialis, coraco for the coracoid process, brachialis meaning it's going to attach to the arm. Both short head and long head crosses over the elbow, and it inserts on the radial tuberosity. General rule of thumb, if a muscle crosses a bone, it acts on the bone, right? Or if it crosses the joint, it has to move the joint. So since the bicep crosses the shoulder, in the front, it's got to move the arm to the front. That's shoulder flexion. Since the biceps cross the elbow, it flexes the elbow as well. So it flexes the shoulder, flexes the elbow, and it's a very powerful elbow or forearm supinator. So if you're like this and you have a screwdriver in your hand and you do this like you're trying to tighten the screwdriver, you will see that the biceps, hopefully I'm in the view here, the biceps contract when you're supinating or tightening something, right? Like this, just like that. Okay. So what else do we have here? Here is a rotator cuff muscle that's on the anterior side of the scapula called the subscapularis. That is an internal rotator of the shoulder. There's a muscle back here that you can see called Teres Major. I'll show you that from the posterior view a little bit better. Again, looking at from the posterior, right, this was the anterior side. Now let's look at the posterior. We see the large trapezius. Once again, we see the deltoid. And we see the latissimus dorsi, which is the widest muscle of the back. Why do we have the widest muscle of the back when we're talking about the shoulder? Because although the lats, or latissimus dorsi, is a lower back muscle, the insertion is on the bicipital groove of the humerus. The lats are a powerful shoulder extensor. Like if you're trying to start a lawnmower and you're pulling that back, That's what the latissimus dorsi does. Okay, upper fibers of the traps, middle fibers of the traps, lower fibers of the traps. Upper fibers elevate the scapula, middle fibers retract or adduct the scapula because the scapula is moving towards the midline, toward the spine, and the lower fibers depress, right? If the upper fibers elevate, lower fibers depress. Here's the posterior delt, shoulder extensor, middle delt, shoulder abductor, anterior delt, shoulder flexor. With the trapezius dissected away, now we can see levator scapula. See 1, 2, 3, and 4, transverse processes. Superior angle is the insertion, as well as a little bit of that vertebral border or medial border. Levator scapula will elevate the scapula, which is like shrugging your shoulders upward. Along the vertebral border or the medial border of the scapula, we can see rhomboid minor and rhomboid major. Because they go from the vertebral border to the spine, it too can adduct or retract the scapula. But at the same point in time, if we look at the direction of these muscle fibers, the muscle fibers run on this oblique or diagonal. They don't run straight across, they're on this diagonal. So it means that not only will it adduct the scapula, but it rotates it this way as it's moving it towards the spine. It moves in this direction. So when the scapulas move in and the inferior angles move kind of in and up, the glenoid cavities, which would be, let's say, my pinkies, rotate down, right? It's kind of like putting your hand on a steering wheel. One hand goes up, the other goes down. So the rhomboids not only adduct the scapular, but they downward rotate because the glenoid cavity is the reference point, and that's pointing down to the ground. So that's what the rhomboids do. Then we can see 3 of the 4 rotator cuff muscles. The key landmark of the scapula is this, which is the spine of the scapula. So there's the supraspinatus, there's an infraspinatus, and then there is a teres minor muscle. So those 3 muscles, the supraspinatus, infraspinatus, and teres minor, are 3 of the 4 rotator cuffs, SIT, supraspinatus, infraspinatus, teres minor, SIT. The 4th muscle is on the anterior side, which is this one here, called the subscapularis. So it sits, SITS. The supraspinatus, the infraspinatus, and the teres minor all have the same insertion site on the greater tubercle of the humerus. Now, if there's a teres minor, there's a teres major. Minors are typically above or superior to majors, just like on the rhomboids. Rhomboid minor, rhomboid major, minor is above major. Here it's teres minor, teres major. Once again, minor is above major. Now here's the triceps. Tricep means 3. Notice this long head right here is piercing between teres minor and teres major. So the long head of the triceps pierces between teres minor and teres major. The supraspinatus abducts the shoulder. The infraspinatus and teres minor both externally rotate the shoulder. So supraspinatus abducts, infraspinatus externally rotates, teres minor externally rotates, and subscapularis internally rotates. So the rotator cuff muscles do this in order: SITS, AB, EX, EX, IN. The EX is for external rotation. The IN is for internal rotation. So you have AB, EX, EX, IN. Abduction, external rotation, internal rotation. SITS, supraspinatus, infraspinatus, teres minor, and Subscapularis. Those are their actions. In terms of their origins, the supraspinatus originates on the fossa, the supraspinous fossa. The infraspinatus originates on a fossa, the infraspinous fossa. And the subscapularis originates on a fossa, the subscapular fossa. So this is why really understanding the osteology and not forgetting it is really important, because it really connects with the myology very much. Okay, so here's the trapezius. You could see the splenius capitis right here, a little bit cut. I'm sorry, not a little bit cut, but if we cut the trapezius a little bit away, we'd be able, or retract it, reflect it back, we'd be able to say splenius capitis pretty well here. All right, so here are the rotator cuff muscles once again. So on the right-hand side, here is the spine of the scapula. When you follow it up, it takes you to the Codmin process. Here's the superior angle, inferior angle, medial border, lateral border. Above the spine of the scapula is the supraspinous fossa. Below it is the infraspinous fossa. And on the anterior side, subscapular fossa. Here is the greater tubercle of the humerus, lesser tubercle of the humerus, with the intertubercular groove or bicipital groove between the two tubercles. Here is the coracoid process and the acromion process. So what originates on the supraspinous fossa? Supraspinatus. What originates on the infraspinous fossa? Infraspinatus. What originates on the subscapular fossa? Subscapularis. And then here's Teres Minor. Teres Minor doesn't really originate on fossa. It's just on that lateral border of the scapula. On the right side of the picture, supraspinatus, infraspinatus, and Teres Minor all insert on the greater tubercle, whereas the subscapularis inserts on the lesser tubercle. And again, their actions, AB, EX, EX, IN. Abduction, external rotation, internal rotation. AB, EX, EX, IN. Abduction, external rotation, internal rotation. Supraspinatus, infraspinatus, Teres Minor, subscapularis. Okay. The one that is torn most commonly is the supraspinatus. The way we would assess that is through a test called Codmin's drop arm test, where I would ask my patients to bring their arm up, or I passively bring the arm up for the patient. I'm holding it for them, and then when I let go, they should be able to hold their arm in an abducted position. But if they can't and the arm falls down, that's a positive test indicating a very likely torn rotator cuff. Another indication or sign of a torn rotator cuff, most people, when they abduct their arm, they could bring it up to the side like this. For a person with a torn rotator cuff, it looks like this. They can't do this, so they lean and they try and use their trunk to bring their arm up. That's a classical sign, okay? Usually of a supraspinatus tear or even a clavicle fracture, typically. They'll start to do stuff like this. Okay, so what muscle is this? Highlighted, it's superficial. That's going to be the deltoid muscle. Anterior delts are here. Middle delts are more on the outside. Here's Pec Major. Here's the Biceps Brachii. Here's the brachioradialis. And a little bit of the lateral head of the triceps on that posterior side. What is the action of Pec Major? It's going to adduct the arm. So if your arm is out to the outside, when your pecs contract, it pulls the arm towards midline, which is adduction of the arm. What is the origin? Well, it originates here on the medial part of the clavicle as well as the sternum. Now, if we pull away Pec Major, here's Pec Minor. Pec Minor originates on ribs 3, 4, and 5 and inserts here on the coracoid process. So they're asking for the insertion, and the answer is the coracoid process of the scapula. Now here we're looking at the lower back. The latissimus dorsi originates on the lower 6 thoracics, the lower lumbars, the sacrum, and the pelvis. This is called the thoracolumbar aponeurosis, and aponeurosis is just a broad flat tendon. So here's the belly of the muscle. It goes underneath that, it wraps around the inferior angle, tucks underneath the axilla, and inserts on the anterior humerus along that bicipital groove. So what is the action of it? It is a shoulder extensor, a big shoulder extensor. What is the origin? Well, here the best choice is the thoracic and lumbar vertebrae. What is the insertion? Does it insert on the inferior angle? Nope, it crosses over it. The inferior border of the clavicle? No, doesn't move the clavicle. Iliac crest? No, it is part of the origin though. Spine of the scapula? Doesn't even touch it. It's the humerus. It inserts on the humerus, again on the bicipital groove or intertubercular groove. What is its primary action? It is involved with extension of the shoulder or extension of the arm. Here is the scapula. Here's the spine of the scapula, medial border. We could see the triceps back here. Here's the long head. Here's the lateral head. And this muscle above the spine of the scapula is the supraspinatus. What's its action? Abduction of the arm. Remember, the humerus is the arm. What is the structure highlighted? So this is the muscle below the spine of the scapula. That is the infraspinatus. That is your external rotator. It originates on the infraspinous fossa and inserts on the greater tubercle. What is the insertion? Greater tubercle of the humerus. Greater tubercle. What is the origin? Supraspinous fossa. What is the action? Abduction of the arm. Now here's the supraspinatus, here's the spine of the scapula, here's the infraspinatus, here is the long head of the triceps, and remember I said it pierces between the two Teres brothers, Teres Minor and Teres Major. So this one highlighted in purple is Teres Minor. If it was this one down more inferior, Teres Major. They're antagonistic, by the way, in action. So Teres Minor is an external rotator. Teres Major is a shoulder internal rotator, much like the Subscapularis. What is the insertion of the highlighted muscle? So here we're looking at Teres Minor. We have to find the greater tubercle of the humerus. And there it is, greater tubercle of the humerus. Supraspinatus, infraspinatus, and Teres Minor all have the same insertion, greater tubercle. Here's Teres Major. We could see it a little bit from the posterior. Even if you weren't sure and you looked at the choices, coracobrachialis, that's here, coracobrachialis. Triceps, well, that's back here on the back side. Subscapularis, that's right there. Rhomboid major, note that's scapula to spine, and then Pec Minor, can't see it here. So only possibility Teres Major. This muscle here is the subscapularis. That's an internal rotator of the arm. Now we're looking at the muscles that go from the vertebral border and the spine. So C7, T1 to the vertebral border, that's rhomboid minor. And below it from T2 to T5, the vertebral border of the scapula, that's going to be rhomboid major. They're adductors and downward rotators of the scapula. Here is a serratus anterior. Serratus anterior originates on the upper 6 to 8 ribs and inserts on the scapula on the anterior side along the vertebral border. It's designed to keep the scapula flush against the rib cage. When the muscle is weak, you get winging of the scapula where it doesn't sit flush against the rib cage, but you can see the vertebral border and inferior angles sticking out quite a bit when the serratus anterior is weak. Serratus, like serrated, it means sawtooth. This looks like the teeth of a saw if you were to cut wood with it. Again, here is the serratus anterior. It wants to know its origin, so it's going to be ribs 1 through 8. Okay. What is the insertion? It's going to be the vertebral border of the scapula.